Tuberculosis has infected 1 out of 3 people worldwide and continues to affect your community. Thank you to the courageous men and women who are sharing their stories in the hopes of spreading knowledge and understanding.
I went to the hospital and then they made me sputum check. That's how they found out that I had TB. And then they were treating me with those drugs, but still I felt sick. So they took me to Saskatchewan, and then there they found out that it was that TB had a resistance to those pills that I was taking. They found some new drugs for me. I ended up staying at the university for a month.
It was in April I started coughing and I started getting mucus and I coughed up blood and I had to go to the hospital right away. They got my x-rays and told me I had TB. Well, a few days later they gave me a container. They made me spit in it. Then a few months later they told me I had TB. It's kind of scary actually.
It's pretty dangerous. And the thing about it is being around people, it's really contagious, and even coughing around people, they can catch it like that too. Yeah.
I don't like telling people that I have TB because I'm scared of what they might think of me. I don't know, they might think I infect people or something like that. I don't like that.
It's pretty hard to admit to others that you have TB. I don't know, it was an awkward feeling trying to confront somebody that you have TB.
Within a family and their relatives, that they'll be very prone to getting TB, both acquiring the germ in its sleeping state or latent TB, and also developing active disease. But other factors which promote TB transmission within the First Nations community is that sometimes there can be crowding within accommodation, especially on reserve, and that TB is spread by inhalation of droplets. People sneeze the bug into the air or cough it into the air, and then it's ingested, it's inhaled by other people.
The signs and symptoms are pretty well chills, night sweats, coughing up blood, lost weight, poor appetite, chest pain, shortness of breath.
Most doctors, especially in the north, are tuned into the fact that TB is a possibility. And so they would conduct the investigations necessary to make that diagnosis, including a chest x-ray, and also they would check the sputum or the spit. And they do 2 things with that. One is that we send it right to the lab and they look at it under a microscope. That gives us a preliminary idea as to whether someone has TB. If we see TB there, then we can start them on treatment right away.
Before they take you out, take you to the sanatorium and keep you there. And now we can go door to door and treat the people. When they have TB, the doctor will prescribe for like sometimes the first 28 days or daily dose, and then sometimes depends on how the patient is, like it's up to 6 months to 9 months. So that's sometimes if it's 9 months, like door-to-door delivery, directly absorbed therapy.
And the TB workers and the physicians and the TB nurses in the city are constantly in discussions about, making sure that people are taking their medicines and that they're doing okay, and troubleshooting little problems that arise.
When we do the home visits, we make sure if they're doing okay and how they're feeling, like mentally, emotionally, physically. We always make sure we tell them this is what it's going to be like, and this is what's going to happen, this is how we're going to do it. And we make them feel comfortable.
That time I had TB first, I was spitting blood a lot. So they had to send me to All Cross, and from there they sent me to Saskatchewan Sanatorium. I didn't know that time it was TB or what. So after they took me to Al Cross, and they took my x-ray. I was there for about 2 days, and then they had to send me by plane to Saskatchewan. So that's where I know I had TB. It seems to me it's like a jail for me that time. Yeah. You couldn't leave. But I ran away from there. After 6 months I stayed there. Well, that time, I really hate to take those pills, but I have to take it. 10 pills every meal, 30 pills a day. On top, the needle. Well, I'll say it's good to be treated for it. If it's not treated, for sure you're gonna die from it. If it's worse, getting worse. My dad had TB too. I remember when I was a little kid. He was in this Prince Albert sanatorium. He was there for about 6 or 5 years. And he told me, he said, I think he had on his lungs, he gotta have operation. If he didn't have operation, he would have died from it.
In the 1960s, they sent us to Fort Capel. There was quite a few people over there from Sandy Bay at the Fort Capel Sanatorium. I was 7 years old. I was there for 2 years.
Yeah, I had TB back in 1979, 78, 79, and half of 80. There were 17 of us from Sandy Bay that left those years to sanatorium in Saskatchewan.
My mother told me I was sick. It was not only myself, but a couple of my siblings were also sick at the time. And then she told us that we were sick and we were going to be taken to the hospital.
I was always sleeping. I was tired all the time, and I lost weight. I was gone for 3 years, 3.5 years. I left Sandy Bay.
We were kept in the rooms. At first, I would say 3-4 months, and we hardly went outside. And after that 3-4 months, and we were able to go to school. We went to school over there, so it was lonely. It was very hard and lonely to be away from your community for 2 years, and as a young girl, it was hard for me. We spoke to each other in our language when we were away from the nurses and the doctors and the caretakers. Like, we had supervisors at night that took care of the floors, and so we were very careful, and we didn't want to be punished anymore.
It was okay. Just the part that hurted me was being away from family. Yeah, and all those years I was just like taken away from my family. Yeah, but then it was good for my health to be coming back home happy and healthy to be with my family.
We weren't taken care of properly. Not like today. There's TB workers that take care of the clients right within the community and offer their medication daily in their homes. I was able to connect with the TB clients here in our community because they didn't know I had TB until I shared with them.
It's unhealthy to have TB, and then you gotta be careful when you're around other people. Talk to the TB nurse or phone to the clinic right away, or phone the toll-free number.
This day and age, we can take care of our clients at home and make them as comfortable as we can and meet their needs as comfortable as we can.
For more information, talk to your local nurse or TB worker or check out www.tbfacts.org.